Choosing the right tool for movement is one of the most profound responsibilities a physical therapist holds. For our patients, an assistive device is not merely equipment, it is a bridge back to independence, a safeguard against injury, and a partner in the daily dance of life. When a person's balance falters, their strength wanes, their body is in a state of healing, the world can shrink dramatically. A correctly chosen and fitted device can let them navigate their home safely, engage with their community, and maintain their quality of life. Your expertise does more than prevent falls. It empowers autonomy and well-being. The impact cannot be overstated. Devices change how a person interacts with gravity and the ground. They alter gait, redistribute body weight, and provide a new base of support. We'll break down walkers, canes, crutches, and wheelchairs. Go beyond mechanics into fitting, gait patterns, and common errors. Our approach: hook, teach, apply, to turn prescription into real-world skill. Walkers are the titans of stability, providing the widest, most secure base of support. First choice after total hip or knee replacement with weight-bearing precautions. Indispensable in generalized weakness, high fall risk, and neurologic gait impairments. The frame surrounds the user, giving constant bilateral support and confidence. Standard walker, no wheels, maximum stability, requires lifting strength. Front-wheeled, pushes smoothly for limited endurance or lifting capacity. Rollator, seat, brakes, basket, best for fair balance and low endurance, longer outings. Hemi-walker, wider base than a quad cane, one-handed support after stroke. Stand tall inside the frame, shoulders relaxed, arms at sides. Hand grips align with the wrist crease. Elbows flex about 20 to 30 degrees. Too high, shrugging and leaning back strain the neck and upper back. Too low, stooping compromises balance and posture. Lift and move the walker a small step. Then step in, weak leg first, then the strong. Stay within the frame. Do not walk too far into it. With a rolling walker, push a short distance and step toward it. Turn in wide arcs. Avoid sharp pivoting. Back up until you feel the chair, then sit with control. The cane is common and discreet, ideal for mild balance needs or slight offloading. It widens the base of support and adds sensory feedback for stability and confidence. Often used for unilateral joint pain or minor neurologic stark vestibular balance deficits. Single point, least support, most portable. Quad, more stable and self-standing, but watch the wider base. Hold in the hand opposite the weak leg. Handle to wrist crease. Elbow at 20 to 30 degrees. Too long hikes the shoulder, too short causes hunching. Replace worn rubber tips to prevent slips. Advance cane with the weak leg, then step through with the strong. Stairs, up with the good, down with the bad. Always use a handrail if available. Crutches, prescribed to eliminate or limit weight on one leg. Post-op, fractures, ligament injuries. Axillary for short-term. Forearm for long-term control with less bulk. Crutch pads sit 2 to 3 finger widths below the axilla. Bear weight through the hands, not the armpits. Axilla pressure can cause radial nerve palsy. Teach strict hand support. Set hand grips so elbows flex 20 to 30 degrees. For non-weight bearing, teach swing through or swing to per safety and coordination. For partial weight bearing, move both crutches with the affected leg, then step through with the strong leg. Maintain upright posture. Avoid oversized steps. Turn with small steps. Back to the chair before sitting. Stairs, up with good, down with bad. The wheelchair, when walking is unsafe, becomes a vehicle for freedom and participation. Common for spinal cord injury, advanced multiple sclerosis, and frail elders with low endurance. It is an extension of the body, primary access to work, social life, and daily tasks. A well-fitted chair prevents pressure sores, supports posture, and can enhance respiration. Manual requires user or caregiver propulsion. Power uses a joystick, critical when manual propulsion isn't feasible. Configure seat width and depth, back height, armrest style, footrests, and add pressure relief cushions for long-term users. Target half-inch hip clearance, full thigh support without popliteal pressure, and our 90-degree knees with parallel thighs. Teach efficient propulsion, curb wheelies, safe transfers, position close, lock brakes, move footrests. Educate on tire pressure, brake function, and weight shifts every 15 to 20 minutes. Common errors and critical safety checks. Incorrect height drives shoulder hike or hunching. Over-leaning creates asymmetry. Never rest weight in the axilla. Nerve injury risk. Inspect rubber tips, walker locks, rollator brakes, and wheelchair brakes before use. Teach footwear choice and hazard reduction. Rugs, cords, clutter, and careful transitions. Practice safe threshold and ramp techniques. Follow a stepwise patient-centered decision tree. Assess, align with goals, match the environment.